Day. And we welcome to the Element Well studio here at the Square, Mike Chaney, the Mississippi Insurance Commissioner. Good to see you, Commissioner.
Always a pleasure to be here, Gerard.
Well, I caught a little bit of your speech this morning from the pavilion. What you talking about? What's your message?
Well, I did vanilla ice cream and apple pie today. You try not to say something too controversial. But our message is that we made a lot of progress in Mississippi. With the help of the legislature, we've been able to avoid some of the problems that they've had in Florida and Louisiana with all the companies going bankrupt and pulling out. So we still have a few problems on the coast, but nothing serious and no big rate increases or anything that would shake up the consumer. So we've been able to handle the market.
All right, so I've heard some rumblings about trouble getting the carriers to cover wind on the coast. What's going on there?
Well, what's going on? Reinsurance, and that's a reinsurance for the people out there that don't understand it, is where an insurance company will sell off a lot of their risk to out-of-country reinsurers. And that's common. That's been going on for thousands of years. They used to do it on caravans. They did it on ships. And the cost of selling off that reinsurance is doubled and tripled in some cases. Okay. And most of that's due to the war between Russia and Ukraine, the threats by North Korea, the problems in China and Taiwan, and then you got Washington politics with the ESG problems. And that plays big. People don't understand what ESG is, but ESG is environmental, social, and governance, and that's a big deal. We're going to be facing a lot of that in the future years, where big companies will have their stock controlled by a consortium of investment bankers, so to speak, and they voted for environmental reasons. Yeah, and they're more focused on those social issues than they are producing a profit and generating returns for their investors, and that can sometimes cause a conflict with fiduciary responsibility, as you well know. Yeah, your fiduciary responsibilities to your stockholders, and if you've got retirement plans that are being controlled by people that don't have the same interests as a company where you have your retirement money invested, you've got a real problem, and that's the problems that we see coming down the pike. What about health insurance? That's a big one, I know, that you deal with an awful lot. You had this conflict that you were in the middle of with respect to UMC and Blue Cross Blue Shield, I believe the largest private carrier in the state of Mississippi. Seems like that got resolved. You pleased with that? Well, we're pleased with the fact that we got it resolved. It took 9 months. I was never pleased with that. And I'm not pleased with the fact that we tried some legislation to kind of open up the door where we could look at how Blue Cross markets their products under what we call the Blue Card program. Yeah. All the commissioners in the United States are kind of interested in that program. But the bill got vetoed. We'll be back, and there are other ways to skin that cat, and I'm doing it. Okay. I don't want to talk about it publicly right now, but I want the public to know that we're trying to protect the consumer. The issue here is that if you pay money for a contract, for a health contract, whether it's through your employer or yourself, that you're entitled to those benefits under the contract. And if they say we're going to do X, Y, and Z and pay certain health care and certain drugs, they got to do it. And they can't arbitrarily now would not pay a claim that's a valid claim, and that's been the biggest problem. And the second part of that is that they have to pay a fair price to the health care providers, and that's where the cloud is. We don't know where the money's going, who gets it, and what happens to it. And I'm not knocking Blue Cross of Mississippi. They're a good outfit. They do a very good job, but they've lost a lot of market share because they don't write a lot of their own paper. In other words, they only write about 240 or 250,000 policies, but they administer almost 1 million policies. And that includes a state plan. And you've got to be certain they're being fair on the policies they administer, because those policies were usually sold at 30% higher than what you would buy one in Mississippi for. So what we're seeing is more of a move towards what we call the Medicare gold standard. That's the market price or the base price of what you will reimburse a carrier for. Medicaid's usually less than Medicare, and commercial insurance range anywhere from 10 to 67, 80% higher than Medicare. So the providers... Medicare or Medicaid? Medicare. Okay. Medicare. So 80% higher? About 80% higher is what they look for. And they'll come into my office and say, look, we can't make it on Medicaid and Medicare. We got to get money from somewhere else. Most of them will tell you that's upside down. And it's upside down. The whole thing's upside down. And then to top it off, the federal government has started doing what insurance companies are doing, and they're going in the Medicare Advantage plans. Nothing wrong with that plan if it's truthful in what they sell to a consumer. But if a consumer buys a Medicare plan, they want to know what doctors in that network and what their formulary is for drugs. And Medicare Advantage plans can just switch that overnight without your permission.
Yeah.
So you may think your doctor's in the network, and you go to the doctor. He said, "I'm not in the network. You got to pay me out of your pocket."
Yeah.
So that's a big, and I don't regulate that. So, I'm going to Washington saying to my congressional delegation, "Hey guys, we're going to start dumping all this back on you because you've got to give us some authority to make sure that the consumer is protected in our state."
The healthcare industry, Commissioner, seems to be in dire straits in the state of Mississippi. Been a whole lot talked about, written about. Some of those hospitals are really struggling.
They really are, and I talked with a gentleman here at the fair late yesterday. I came around making some rounds, but I ran into my old friend Jim Perry, who chief of staff for Haley. And Jim's a really smart guy. He's in the investment banking business. And we talked about, he's on the state health board, of trying to do a study on rural hospitals. And they've got the money to do it. They're starting one. And I legally can do a small study on what we can do on the healthcare side. So we're going to try to combine our forces to look at the rural healthcare problem and how we deliver healthcare. The model's changing. You look at Greenwood. My oldest child was born there. Greenwood will probably go under unless we pull a rabbit out of the hat. But to provide healthcare in that market, we've got to change how we do that. One of those parts is telemedicine, and that leads us back to why we had so many problems with Blue Cross Blue Shield. They didn't want telemedicine.
Right.
The other is doing what we call kiosk and strip.
Well, it's not that they don't want it; they just don't want to reimburse for it.
They don't want. They want to pay half of what they would pay for an office visit. And Gerard, that goes to ambulatory surgery. But now we got off in the ditch. So ambulatory surgery is where doctors like Jackson Hart will have their own clinic outside of St. Dominic's. And the health insurers want to pay less than what they would pay if you were in the hospital. And somewhere there's some medium in there where we should all meet. But I don't have the ability to help negotiate that. My job is to protect that consumer out there that thinks they're going to have a bill paid because they had a contract. And it doesn't get paid.
Yeah. Well, of course, the issue of Medicaid expansion, as you well know, has been discussed quite a bit in our state. We are now among 10 states. The latest to expand was South Dakota. Just went into effect July 1, so there are 10 states that have not. Of course, you're well aware that would extend coverage to able-bodied adults with an income below 138% of the federal poverty level. It's estimated we have about 220,000 Mississippians that would receive coverage or be eligible for coverage in that plan. The hospitals say we're treating them now, we're just not getting any money for it.
Well, I don't necessarily agree with the hospitals on that issue.
Okay.
They may tell you that. But I've asked them to show it to us on paper.
Okay. Because
here's the deal. They may say we're doing indigent care, and they'll charge that indigent care at the highest price possible. Let's say that an appendectomy would normally cost you $2,000 or $3,000. That's appendicitis. On their books, the base price is $20,000.
Yeah.
So they'll charge $20,000 on indigent care against their bottom line. So we have to look at that. So let's go back to your Medicaid expansion question. I think it's a little late to be talking about that. The legislature doesn't have the fortitude or the will to pass Medicaid expansion, and that train's kind of left the station. We missed that boat.
Yep.
So here's what we're doing at the Department of Insurance.
Okay.
We have the ACA, and the federal government's helping us advertise this. You can move people that are on Medicaid. And when they get off of Medicaid, and we took $29,000 off in June.
First month.
About half of them can get on the ACA. And we got to make sure we have open enrollment and adequate help. That means network adequacy. But here's the catch. They got to pay part of the price. It's not free. And most people, if you got a cell phone, you can pay $40 or $50 a month to get some primary health care.
Yeah, well, under 150% of the federal poverty level, their premiums are zero, but they're still responsible for the out-of-pocket costs.
Yeah, they got to pay out of pocket.
Could be up to $3,000. Could be up to $3,000 a year.
But
there's some other subsidies they get to even offset some of that. But yeah, I hear you.
So it's
a route, and I've talked to the members of the legislature about this, Mike. I've explained this as a rule that just went into effect permanently. It was temporarily in effect during COVID. It ought to be an option for us.
And it would be cheaper for us to do that.
Yeah,
and
no state cost.
And no state cost to us.
Yeah.
And that's where we ought to be.
Keep pushing that.
I'm pushing it.
Okay. All right, we appreciate you coming on as always, Commissioner. Good to talk to you, sir.
Always a pleasure, Gerard.
Yes, sir. Good luck to you in the election coming up.
Thank you. Appreciate your show.
Yes, sir. Thank you. We're coming right back, folks, with Lieutenant Governor Delbert Hosemann. We're in the Element Well studio at the Neshoba County Fair.